Hello, my name is Tanya Gonzalez. I am not a health studies major. Health studies is actually my minor. My major is nursing. To be quite honest, I had not planned on minoring in health studies. The reason why I came across health studies is because I had already finished all my prerequisites for nursing except for one class that was holding me back from applying to the nursing program. As a result, I started to think of how I could still be a full-time student so that it would not affect my financial aid, grants, or scholarships. I did not just want to take any random classes just to take them because what was the point of that, right? So then that is when I decided that I should minor in something, but not just anything. I wanted something that was beneficial for me, that would help me along in my career. Um, Something that went hand in hand with nursing. At first, I was looking into nutrition, but it didn't really catch my attention. So then that's when I came across health studies. Um, I chose nursing as my major because I have always had admiration for nurses and doctors. As a young child, I was always a sick kid. I was always in and out of hospitals. So as a result of that, I was always um, talking to nurses, new doctors every day, new nurses every time I would visit the hospital, and things of that sort. So one one main reason that I remember why I wanted to become a nurse was because I had this one nurse. She was very rude whenever I had an encounter with her. Um, and ever since then, I've always told myself and told my family that I've always wanted to become a doctor, that I'm going to become a nurse. And then when I became a nurse, that I was going to treat all my patients with respect, and I was going to treat them with care like if they were my own family, and that I would never disrespect them, that I would never treat them wrong, and I would never make them feel like if I didn't want to help them. I was always going to be there for them. Um, Another reason why is because I've always loved helping people. I've always loved being around little kids. Little kids are just lovable, and they're just my weakness. Every time there's a family, one of my family members has a baby, then there I go running to visit him or see her. It's just every it's just I'm a babysitter, so I just love kids. Um, um, I figured that health studies really go hand in hand with my major because um, health studies would help me help others to understand the importance of healthy living. Health education to me it is interesting because it not only has one definition, it has multiple definitions. Anyone can define health studies in their own way, or not even at that, but anybody can define health in their own way. um, I personally believe that health studies is anything and everything that has to do with health, physical, either if it's physical, mental, or just your well being. Um, the populations that really interest me, that I really want to help and be involved with, is babies and children and mothers. I want to be able to help mothers, help give mothers advice on um, how to make sure that their kid is healthy, or that they're getting all their nutrients, that they're eating healthy, that they're being active, um, that basically everything that has to do with well-being, physical, mental, anything that a kid, that a kid would need for it to be healthy, for them to be and grow up healthy, and not to be in and out of the hospitals like I was when I was a child. Because when I was a child, um, I can see the confusion in my mom's my mom's face when the doctors would like tell her certain stuff, and then she just wouldn't understand. So I just want to be there. I want to be that nurse or that person who they can go to and have enough like they won't be shy to ask, or they won't be too scared to ask a question. I want to be that person for them. So yeah, thank you for listening.